Hello, my name is Carrie Carroll. I'm a family nurse practitioner, Auburn graduate student, presenting my 5-minute lecture on osteoporosis. Osteoporosis causes multifactorial, such as genetic factors, bone density, lifestyle, disease-related, and medication. Often called the silent disease, is a skeletal disorder characterized by normal bone mineralization, low bone mass, and the disruption of bony architecture. It predisposes individuals to fractures, and it can be the result of the declining estrogen levels during the postmenopausal period, leading to increased bone resorption, thus increasing the risk for fractures in women. Risk factors include the female sex, estrogen or testosterone deficiency associated with advanced aging, small body frame, tobacco smoker, corticosteroid use, hypothyroidism, medications, fractures following minimal trauma, white or Asian women, chronic alcohol use, calcium or vitamin D deficiency, postmenopausal, and a family history of osteoporosis. 3 key questions to ask the patient. First, do you have any back pain? The gradual development of upper to mid-thoracic back pain associated with activity or long periods of sitting or standing that is relieved by rest in the recumbent position may be the only symptoms noticed. 2, have you noticed a loss in height? Reduction in bone density over time leads to a loss in height for microfractures, and sometimes this is the only complaint recognized and noticed by the patient. Third, do you have a history of fractures? A history of previous fracture increases risk for future fractures due to bone loss, especially in the postmenopausal period. Key physical exam components. Often, osteoporosis is asymptomatic until fragility fracture occurs. You want to measure the height and compare to previous readings. If you notice a height loss of 4 centimeters compared to the historical maximum, or 2 centimeters compared to the previous measured height, this could be indicative of osteoporotic changes. You want to assess range of motion, weight bearing, and gait. A limited range of motion, abnormalities of gait, posture, balance, and muscle strength could be indicative of osteoporotic changes. And then you want to examine the back and spine to assess for kyphosis or stoop posture. A decrease in bone density over time can lead to the accumulation of microfractures of the anterior vertebral bodies in the thoracic spine, leading to dorsal kyphosis, also known as Dowager's hump, and this produces a loss of height. You can then palpate or percuss for point tenderness. Pain can be elicited in the acute compressure fractures of osteoporosis patients. And then you want to compare the physical findings to the bone DEXA scan. A T-score of 2.5 or greater is indicative of osteoporosis. Women of 65 years and older or younger postmenopausal women with risk factors should have a bone DEXA scan every 2 years. Non-pharmacological treatments include increasing dietary sources of vitamin D and calcium. These can be found in dairy products, fish, fruits, and vegetables. Regular weight-bearing exercises 30 minutes a day, 3 days a week, including walking, running, weightlifting, and aerobic exercises, and the reduction and elimination of smoking and alcohol consumption. Pharmacological treatments include calcium and vitamin D supplementation. The recommended calcium supplementation is 1,200 to 1,600 milligrams daily, and the vitamin D is 400 to 1,000 international units daily. But for postmenopausal women receiving the adequate intake of dietary calcium alone, which is 1,200 milligrams, do not require calcium supplementation. Bisphosphonates for 5 years are the first-line treatment for the prevention and treatment of postmenopausal osteoporosis. These include Fosfomax, Boniva, Actonel, and Reclass, which is an IV yearly medication. Monoclonal antibodies such as Prolia is a sub-Q injection every 6 months. These are used for high-risk patients, patients with a fracture history, or who have failed previous treatments. The parathyroid hormone Forteo is a daily sub-Q injection. The downfall of this medication is that it only has a 2-year treatment limit. And the expected outcomes are to stabilize bone mass, improve mobility, reduce pain, and maximize physical function and prevent fractures. Priority teaching components. You want to ensure the patients engage in active weight-bearing exercise daily. This will improve the bone mass in premenopausal women and aid in maintaining bone density in postmenopausal women. It will reduce the risk of falls by strengthening muscles and improving balance. You want to ensure that adequate intake of calcium and vitamin D so that bone reduction is lowered and the fractured risk is lower. and have yearly height measurements to determine the effectiveness of osteoporosis treatment, and avoid smoking and limit alcohol consumption. Patients with osteoporosis that consume 2 or more alcoholic drinks a day have an increased fracture risk, and smoking can cause a rapid bone loss and increased fractures. These are my references. Thank you very much.